And welcome back. Well, if you've ever experienced vertigo, dizziness, or ringing in your ears, you know that you'd do anything for it to quickly stop. Meniere's disease is an inner ear ailment caused by these exact symptoms and requires medical help.
Pharmacist Debbie LoCurto joins us now from Lakeview Pharmacy to talk about causes, treatments, and how compounding pharmacies can be of help to stop an attack of Meniere's disease. Welcome.
Thanks for being here.
There's, you know, a lot of people have ringing in their ears. We'll start with that. This is a disease, for example, that I've never heard of. So I think the point for people is if you have ringing in the ears and some of these typical symptoms, don't just write them off and think, oh, I have to live with it. You might get a diagnosis which can lead to successful treatment.
Correct, correct. And you do want to see a doctor to get the diagnosis. All of these symptoms can be many different things, but they are associated with Meniere's disease.
So there are things like ringing in the ears.
Probably the one that's the most debilitating is vertigo, or that sense of dizziness or spinning. When you have Meniere's disease, that can last anywhere from 30 minutes to 36 hours. So it can be a very difficult thing. And then the ringing in the ears is another one, or a buzzing, that's called tinnitus. Another is hearing loss, and usually with Meniere's disease, that's the lower form of the sounds, not the higher forms, and it usually is always only in one ear, but many times it can be in both ears as well. And when an attack hits, usually then the hearing loss can actually be a little bit worse, and then it can come back a little bit too. So,
so all these symptoms, the vertigo, the hearing loss, the how do you say it, tinnitus, and you know, pressure. That's another one. Feeling this pressure in your ear. These are all part of Meniere's disease. What is Meniere's disease? Is it a how would you describe it?
It's actually an inner ear ailment due to an accumulation of fluid. And so that it's the fluid that's causing the problems within the ear.
Can the fluid just be removed?
In some cases they can. There are some procedures. Usually though, we always start, the place we start first is diet. A low sodium diet is usually recommended. Caffeine restriction is recommended, and in some cases alcohol reduction is usually a place to start. Then they'll move on to medications, and there are some things over the counter. There's a supplement called lipoflavonoid, which is very effective against ringing in the ears. And then during the vertigo or the dizziness spells, meclizine is another over the counter.
It's like then Dramamine, right? A lot of people know they
Bonine, very similar to that. So those are some things over the counter. But then there's also prescription medications, and one of the first place to probably start there would be a diuretic or a medication that pulls fluid off the body. Hydrochlorothiazide, which is a very popular one, they use it for blood pressure, that's used a lot of times. But then there's also beta-histine, which isn't actually available here in the United States, but it's very commonly used in Canada and Europe. And since we're a compounding pharmacy, we can actually make up beta-histine for use in patients if they would need that.
It sounds like that would be part of an allergy type medication.
It does kind of sound like that a little bit, yep, it does. And it does kind of, the mechanism of action isn't solely understood, but it does help with the reduction of fluid in the ear to alleviate those symptoms.
And I wonder, for people who aren't familiar with compounding pharmacies, the medication that you can get that's not available here, obviously that's a potential benefit for patients who have Meniere's disease. But what is it specifically about a compounding pharmacist that will help people who have this particular disorder?
Well, a compounding pharmacy actually formulates and makes the medication in their compounding lab. It's a very old practice, but something that is kind of coming back into vogue again a little bit. And so we can, and we usually really work very closely with the doctor and the patient and thus us. So there's 3 of us that are working together, and we tailor make the medication specifically for that one unique patient.
Everything I know a lot of people that only use compounding pharmacies, you know, because they know a lot of the bindings and the fillers and things like that are absent when you use a compounding pharmacy, that it's a much purer form of the medication that you need.
In some cases, what you were talking about, there's many different reasons people would come to a compounding pharmacy. Typically, it's always because the manufactured medications just aren't working or not available. So there again, if you're allergic to some different fillers that are used primarily and manufactured, we can come in and help come up with a formulation that doesn't have the things that would be difficult for that patient to use. We can also come up with dosage forms, pediatric and veterinary, where the manufactured products are only in certain dosage forms, but that's not appropriate for, say, a 10-pound dog when it's actually being made for a, an adult.
Amazing that you do that for pets as well. Thank you so much for the information. Important to get diagnosed if you suspect that you might have Meniere's disease. You can call Lakeview Pharmacy. Find out more about compounding pharmacies at 262-632-0520 or go to lakeviewpharmacy.com. Wonderful
Thanks, Debbie.
to meet you.
Oh, thank you so much.
Appreciate it.